Come on up, team. Good morning, everybody. I thank those of you who braved the snow. You know, I'm not from Washington, and I historically have always watched the roads get plowed after a snowstorm. I guess that's not the tradition in Washington. But and for the many, many more at home who wisely did not try to brave this weather to come in, thank you for joining us. Guys, come on, cuddle in here a little bit. I'm going to introduce you all. Come over here. It's like a sister to me, Amy Gleason. Oh, there. From the moment the President and Congress enacted the Working Families Tax Cut legislation, we've been very hard at work trying to implement the various aspects of it. In fact, even that weekend, remember it was signed on July 4th, even that weekend we were working on some of the most important elements of the legislation that we thought were important to protect our most vulnerable. And the Working Families Tax Cut legislation, which I do think is one of the most ambitious efforts to right-size the healthcare system at the right cost and put the money in the right places, has been a landmark effort to readdress what community engagement really means. And this is a critical concept because there are many ways of defining what it means to be engaged in your community. We thought it was important to both adjudicate what that word really meant and then put technology in place that would allow us to be sure that these programs were being implemented correctly and folks who are appropriately doing the things that they're supposed to be doing to engage in life were appropriately rewarded. So we got some big announcements regarding this implementation. But first I want to set the stage on why community engagement is so important. We give it a lot of lip service, but our nation's program around Medicaid was supposed to be a path to prosperity. It was supposed to put our hand out and help you come back up from whatever problems you were facing. It's not supposed to be a permanent landing spot, which unfortunately is what has happened for many able-bodied Americans, and that's a tragedy. And when the program was initially inaugurated, conceived in 1965, no one really thought about able-bodied people on Medicaid, but they spend on average about 6.1 hours a day watching television or hanging out. And leisure time at that magnitude, if you're able-bodied, is not a healthy thing, is evidenced by the fact that opiate addiction rates start to increase in this population. They're not happy. They know they need and should have agency over their lives, and they don't feel like they're being challenged. And there's other reasons why they're struggling, but we need to help them in many ways. And one of them is to make sure that they're not held back from reaching their potential and allowing problems that would actually crowd out others who are on the program, and which also compromises the care of the folks who the program for Medicaid was originally designed. As of last year, unemployed, able-bodied Americans made up roughly a fifth of all the Medicaid beneficiaries. The community engagement requirements are designed to turn this around, to give people a chance and to nudge them in the right direction, as well as giving them a hand up when they want it. These programs are designed to connect able-bodied adults on Medicaid with work, with job training, education, volunteer opportunities, all the things you'd want for people that you care about to be able to re-engage the communities that they live in, and would increase their incomes and also provide upward economic mobility, something that's so traditional, so core to our nation. It'll do it for themselves, it'll do it for their children and their grandchildren. We no longer will have generational poverty if we get this right. As able-bodied individuals find their way off Medicaid and into employer-sponsored health plans, this will leave a lot more room for the precious program of Medicaid to take care of our most vulnerable. Now, the dignity of work is something I think many of you will appreciate anyway. It's an innate desire that we all have for fulfillment, and it gives meaning to the world around us, but also gives us an opportunity to give back. I've seen this motivate patients to recover from illnesses even more rapidly because they know there's something out there that they're supposed to do. When we're encouraged to engage in our communities, we discover talents, we discover friends, we deal with some of the loneliness. And that loneliness has become a real problem as we've been discussing at this agency for quite some time. Secretary Kennedy has been highlighting this issue as he tries to address some of the challenges with mental health and anxiety and depression that are plaguing so many Americans. In fact, there was just to put a little number on this, the Surgeon General in the prior administration had released a report in 23 arguing that the loneliness risk was equivalent to smoking 15 cigarettes a day. I remember that number because it was such a tangible way of defining the actual mathematical risk of being lonely. There's lots of indirect expenses associated with that in both lost years of life, lost quality years, but also cost to the healthcare system. And oftentimes the most effective remedies to combat this crisis are the ones we overlook. And a lot of us would have to say that work is one of the best places to avoid loneliness. For good or for bad, you're forced to be with people and get along with them enough to be able to accomplish a common missile. Plain and simple, work is healthy. Now, this administration has been able to use the power to convene quite effectively to get to this endpoint. Obviously, we can pass legislation, we can we have a rulemaking process in the administration, but across government and industry, we have used the power to convene. We've done it successfully with prior authorization that's still ongoing, with insurers that cover 80% of the American people. We've succeeded remarkably effectively with most favored nation drug pricing negotiations with the major companies in this country that produce innovative pharmaceuticals. We're now applying that to federal, state, and industry partnerships around the work requirement. That this could not have even been conceived without bringing top-tier talent into this agency. Under President Trump's leadership, there's been a magnet effect of bringing folks who are quite successful in the private sector into government. It's definitely helped Health and Human Services and CMS bring people in with the capability of achieving what you're about to hear about. Chief of Staff Steph Carlton at CMS has been instrumental in recruiting a lot of these people. Dan Brillman, who you're going to hear from shortly, came to us from the private sector. He was in the military to boot. And I've witnessed both sides of that personality that he has, because you cannot hold the man down. You will learn to love him as I have. And he's had tremendous experience dealing in the Medicaid population in the private sector, and he's brought that wisdom into the agency. His experience paired beautifully with Caprice Snap, who's had tremendous public policy experience running Medicaid in her state, but also here prior to Dan's coming in. Grant Thomas, who you hear from in a second, is our go-to man. Like a utility player. He can take care of everything. I've started calling him on personal health problems. It's remarkable. You'll enjoy him as well. Andrew Johnson, Rebecca Armstrong, who runs Office of Legislation. Actually, I see her right back there with her son, who's playing hooky today. Did he get off from school today for snow? 34 minutes. Also want to bring in Amy Gleason for a second. She and Alberto Colon, Vieira, and Ming Lai have been helping CMS pilot tools. She's been very helpful supporting the CMS team across the board, but she actually is leading the tech transformation of the entire organization. You want to say a few words about some of the things you've been doing?
Thank you. So CMS is on a huge strive for modern innovation. So we started with Medicare, and we are modernizing that claim system there, and we're working on interoperability to bring data out to providers and patients where they need it. We're empowering patients by updating Medicare.gov and bringing them tools for their daily life so that they can have innovative tools to help with their health. And now this is just another step in that direction where we're modernizing Medicaid as well. We have a tool that we call IMI, that is an open source tool that's available for the states and the vendors to use to be able to make eligibility easier for them. So we started pilots last summer to really start testing out ideas and data sources with the states, and we've seen great progress there, and we're really also giving states free technical assistance along with this, where we can send technologists out to help them meet these requirements. So we're confident as we start to modernize Medicaid that they'll be ready to meet these deadlines, and we're here with them every step of the way. Dr. Klaas?
Thank you. So we're going to be announcing major commitments now that we have made to the states. They were challenged both for the concerns about being able to accomplish the task technologically, be able to afford to pay for the requirements of the Working Families Tax Cut legislation. And they also didn't quite know how they're going to work with the federal government, because running Medicaid is a little like pushing on a string. So we had a few issues we had to address. Amy pointed out that to learn better the challenges that the states and the vendors face, we actually got into the space a little bit. But community engagement is far more than a policy prescription. It represents a generational opportunity for us to empower able-bodied Americans to serve their neighbors, reach their dreams, and improve the world around them. And it's going to happen because of Dan Brillman. Dan, God bless you for all you've done. Take it away.
Thank you, Administrator Oz. Dan Brillman, the Deputy Administrator and Director of Medicaid and CHIP. Dr. Oz spoke just now about the administration's power to convene. This is just yet another great example that we're going to announce today. I'm excited to walk through some more details of our initiatives to modernize Medicaid and work with states efficiently to implement really well. First, I want to thank our staff. You'll hear from Grant a little bit, and Dr. Oz talked about our staff. They work hand in hand with states and beneficiaries to support them every day. I want to thank the President, Secretary Kennedy, and the Administrator for providing us, honestly, with this environment that allows us to go in, roll up our sleeves, work with vendors, work with states, work with the stakeholders in the private sector to actually accomplish what we're about to announce today. Finally, I want to thank to the companies that we're announcing today for their contributions and commitments over the coming years, not just for the implementation, but they stood up in service to help Americans engage in work and in their community. And as Amy talked about, this is just the start on how we're going to modernize and revitalize Medicaid innovation. It's greatly needed. We need better collaboration, as we're announcing today, between the federal government, states, innovators, and most importantly, we need a better beneficiary experience. Every state will tell you that, and Dr. Oz has brought in the best team to be able to do that. The savings we're talking about today is $600 million. This is massive savings that we're bringing to not only federal government, but this is really also for states. But it's not just about the savings. It's how we as a country work efficiently together, hand in hand, to support Americans in engaging in their community and in work. And we get to lead in that journey and support beneficiaries in their path to prosperity while improving their well-being and economic mobility. I want to talk about background before we get to the negotiations and the pledges that we had. But we brought states together with vendors, and we actually built technical and functional requirements. And so for the first time in the history here, we put together requirements that put everyone on the same page. And what does this actually mean? One, it helped us work with the vendors to say, hey, what are your costs with each of these pieces? But it also eliminates silos and customization that create unneeded complexity and burden in the program. And we want to streamline the program and make it better for beneficiaries to experience that across 50 states. No longer customization that's happening inside of states. Two, we used our power to convene. We brought innovative vendors that have had hard times to get into Medicaid into states onto demos and to working sessions with the states so that we can help bring states new innovative technologies that improve the experience around connecting to work, to education, volunteering. How do we coordinate care better in the community using technology first? And using data-first approaches, as Amy talked about a little bit again, which again improves the beneficiary experience. And I can't thank Amy enough and the team for getting ahead and actually testing with states on how we automate and use data-first approaches that don't need the beneficiary always to be there, pulling out documents, making it easier for them to comply with the requirement as well. So I want to turn it over to Grant Thomas, our senior advisor. He's going to talk first about what we did with the innovation and bringing innovation in Medicaid with innovative vendors. Go ahead, Grant.
Thank you, Dan and Administrator Oz. So as Dan said, let's talk about bringing innovation into Medicaid. Too often, tech startups and innovators face significant barriers to entry that can adversely impact their ability to work with states. So we helped. We worked with GSA, the General Services Administration, to streamline pathways for qualified vendors to obtain a GSA schedule. This will allow states to more quickly procure technology solutions at transparent prices. This also levels the playing field and allows for vendors who qualify, both existing legacy vendors who have been in the market and working with states for a long time, and innovative startups with an additional pathway and option to provide their products and services to states, eliminating some of those barriers to entry. Our announcement today highlights a number of companies offering CE technology products and services who are already on the GSA schedule. So we're making that transparent and highlighting companies already on the GSA schedule today for states to leverage. And we're also highlighting innovative companies that are in progress with getting on the GSA schedule through an expedited manner. And we are working hand in hand with them and facilitating that work with GSA so that they can quickly get onto the schedule and work with states if states want to access their services. Any companies not in the announcement today, we encourage to please reach out to CMS, and we stand ready to help get them on GSA if they qualify. And now I'll turn it over back to Dan.
Great. I appreciate that, Grant. So why did we get them on the GSA? I think let's talk about what type of innovation we want to bring to states and to Medicaid. We talked about connecting to work, connecting to volunteering, but really these are all paths to prosperity and improving income and well-being for our beneficiaries. So the things that we are bringing forward to states and making sure that they know that are out there and there's procurement paths for them is thinking about automated outreach and engagement, using analytics and prediction. So if you're a beneficiary, so that your plan or the state can reach out and say, hey, you may need these types of services proactively. Hey, here's how we're going to help you do that. Could be job training, as an example, that may improve their income. We want technology that's going to connect beneficiaries to work and volunteering, but more importantly, track those outcomes. And if they have barriers, and we talk a lot about this at CMS, we want to make sure we're coordinating those services between agencies in an accountable way with healthcare and community partners, so that we can help close those gaps and make sure you're in that position to be able to work and volunteer. And then also we want data-first approaches and automation versus more paperwork for beneficiaries and service providers. So what does that mean? We want to check data automatically, which happens a lot in today. We want to make that better and saying you're good to go, beneficiary. You don't have to put all your paperwork together and make this burdensome on you. So the more we can do that, the better we make that experience for beneficiaries. And then we want easier consumer applications. So you think about the application when you're just first starting getting on Medicaid and you're applying for Medicaid. Hey, we want to do this on the phone. We want to ask you some questions to make sure you're eligible. Here are the things that you're going to prepare for and need for. We need to make that easier in all 50 states, and we want technology to be in the hands of those states as well. So that's on the innovation side. Now let's take a step back and talk about the $600 million in voluntary commitments from 10 companies. This is monumental in nature, but I want to point out some background and some great highlights. First is we work specifically with the existing companies with contracts in states that support eligibility and enrollment, a very specific system that is where these changes are going to occur. And then based on estimates, most states think this was going to cost between $3 and $10 million to implement. Now, the bill provided anywhere from $2 to $20 million per state for grants to implement community engagement requirements. So what do? We helped and worked with these vendors to look at and think about prices and negotiations in a way to not only cover core costs that you'll see, a lot of no-cost offers for cloud-based software, which we greatly support. You're going to hear a lot of that for the next multiple years, or you're going to see $2 million fixed fees or under. And that allows states to not only think about, hey, okay, I'm covered in these costs here, but how do I innovate and use dollars that I also have from the bill to invest in innovation as well? A couple highlights on these pledges. First, this is not 1 year. This is multiple years. This goes through 2028. These vendors stood up for multiple years to help their states that they're working with to invest in technology. What does that provide? That provides predictability for states so that they can better long-term invest in innovation and not just making incremental changes to systems that don't necessarily improve the beneficiary experience. The second thing is these are cloud-based reusable software packages at no cost that you'll see through 2028. This is especially exciting as we modernize Medicaid and move into a cloud-based scalable environment. We're trying to move away from on-premise or things that are in the side of the states that maybe have servers in a closet. We want 2026 technology in the hands of states that ultimately can be advanced and make better every single day. Several providers, this is really important, are providing no-cost integrations with SNAP and Medicaid. So that's our partner agency. But what does that mean? That means we're going to automate the compliance for Medicaid community engagement when someone is already compliant with SNAP work requirements. And so when you can automate that process, that takes the person out of the process as well, making it easier on the beneficiary too. And so when they're utilizing multiple benefits like SNAP and Medicaid, where there is a big overlap, we can automate tons of those processes for states and do that at no cost. Almost all of the companies discounted professional services or fixed their fees or did not raise any costs in the out years as well for maintenance. Some did not just do this for community engagement. Some did it for all working families tax cut legislation changes as well. So they stood up even above and beyond the community engagement requirements. Some offered new products and add-ons at no cost to support program integrity efforts, which we're very focused on, and we greatly support that. Incorporates the use of AI as well. So these are wrappers that can sit on top of technologies, and these are at no cost too. Lastly, the companies were extremely excited to do this. I just really want to point that out, and the states have also asked us for help over time as well. We have the background to do this and dig in with all the stakeholders together. And then really everyone's really focused on getting to work. And not only work in the community as part of the requirement, but getting to build with states and the vendors and us together so that we can get beneficiaries access to work and engagement in their community. So in the end, we're going to publish the fact sheet with both vendors on the GSA, as Grant, our senior advisor, spoke about, that are on, plus in process as well, and then each of the 10 vendors, which is going to be public and transparent, on the details of their offering. We're excited to continue on the journey with these states, and this is just really the first step in how we modernize efficiently and we bring innovation and solutions into Medicaid. So thank you, Dr. Oz, for having us, and we'll take any questions. Thank you.
Hi, thanks for doing this. This question is either for Dr. Oz or for Dan. I know you asked California to produce a program integrity action plan around anti-fraud efforts. Are you going to suspend or withhold its Medicaid payments if it doesn't comply? And then I'm also wondering, is CMS shifting its anti-fraud strategy to preemptively withholding Medicaid payments? I know the traditional approach has been pay first, prosecute later.
Paige, thank you for the thoughtful question. We're looking at deferring payments based on audits that we'll be doing for 2025, but also as we get more data into this year as well. Part of the problem with auditing Medicaid is like pushing on a string. We have to work together with the states in order to get their data. We also want to help the states keep up with some of these challenging areas. And so ideally, it's about not letting the money leave the room. It's much less important for our agency to put people in jail than to make sure that these perpetrators aren't able to get the money, because they end up escaping overseas frequently and the money leaves the country almost immediately. So we are working with Treasury and the Department of Justice, OIG, FBI, all of us together. Everyone has their own focus areas, but ours, without question, is to preemptively stop the money from going out. And to do that correctly, we need better rules to define what services qualify, especially for home and community-based services where you don't sometimes have a licensed provider, so it gets sort of difficult to tell who's doing what when. All this has to be solidified, and there's been a lot of slippage in this program over the last several years, and the fraud that we're witnessing around the country, and it's not just California. California happens to have had pretty severe problems that seem to have been underappreciated, undermanaged for a longer period of time, but the problems you saw in Minnesota, we're seeing them in Florida, New York, Pennsylvania, my home state, and we're seeing it across the country. So this is a systemic issue. We need to deal with it in that capacity.
I also had just a question. You guys kept mentioning, I think, $600 million in savings. Can you clarify a little bit more what you mean by that and where those savings are coming from?
And Dan, when you answer that question, could you also, you said it, but I want to make sure they're clear. What does it look like from the perspective of a governor to understand what these numbers look like? What do they need to spend? What do they think they're going to spend, and how will this help them?
Sure. Yeah, so as I talked about before, when we talked to the states, the majority of them thought it was going to be between $3 and $10 million to implement this. You're going to see in the fact sheet, each vendor has specific details. So one of them, as an example, is going to be $2 million fixed fee, right? And so if before going there, their cost might have been $6 to $7 million or $8 million, and there's 10 vendors, right? So some of them are fixed. And so when you get down to $2 million exactly, that is for, they're getting, the actual implementation with no additional costs related to that. Another vendor said, hey, we're going to actually just provide, instead of it's going to be, multi-million dollars, we're going to provide it for no cost for our license through 2028. So this not just goes for the initial implementation, we're talking about over 3 years. So a lot of these vendors may have their pricing published, or they were going to be in negotiations or already in negotiations with those states. We said, let's take a step back. Let's make sure we know we're giving money to the states as part of the law. They're getting grants already. One's out the door. There's another one coming. We want to make sure we work within that grant to making sure that they can comply with the requirements, and the vendors also can build, in the time that they need.
So that's savings off of what was provided in the law, or savings off of what they were
Savings
otherwise?
off of what otherwise would have been charged, right? And
Okay.
so why the vendors, when the vendors were in negotiations with, and they already started, right, since they've had about 6 months, they've already been talking. Not a lot, and some of them we kind of got ahead and said before they signed contracts, they were already negotiating, right? And so some of the costs would have been, definitely would have been higher. We came in and said, hey, they're getting this type of money. Can you come in under this? Can you do it for free? Or can you do pieces of it for free based on, the scale of your business? You might be in 20 states, you might be in 3 states. You're able to take off this profit and do this part for free. Each vendor is a little bit different in their construction and where they are. Some of them manage other systems as kind of systems integrators. Some of them manage their own technology. So each one had their own piece to kind of give. Obviously, some are taking off profits. Some are giving literally at no cost.
Okay, thank you.
Hi, thank you guys for doing this. I'm Sarah Cliff with the New York Times. I had two questions. One is a follow-up on Paige's. Dr. Oz, you mentioned that you're seeing similar things to Minnesota and Florida, New York, Pennsylvania. I'm wondering if you could share any more details. And then I have a question on the new technologies, but should I wait for that one after the fraud one?
I'll take the first one.
Okay,
Thank you
thanks.
for querying about, let's take Florida as an example. Their durable medical equipment is the providers sell wheelchairs, knee braces, a variety of products. They play an important role in the ecosystem of providing health care, especially to seniors. And you need a fair number of them. But in South Florida, there are 20 times more DME providers than McDonald's, which I didn't believe initially, but I went there. And it's remarkable. And many times they're clustered together, same address, not billing anything. They're called bust outs. They don't actually ship any products. They have no people working there. There's nothing in the office. And what they do is create fictional bills, send them out. They know how to game the system. They get paid within a couple weeks. By the time we find out that they billed us $5 million, the money is gone. Now, there seems to be involvement, and I'm told this from law enforcement there as well as some elected officials, that many of these folks flee back to Cuba. There might be involvement of the Cuban government in this process. By the way, we think there's involvement of the Russian government and some of the things in California. We know there's potential involvement in overseas countries in Minnesota. So this is not just U.S.-based fraud, but it is weaponized fraud. And these are often multinational criminal organizations that also do money laundering and are involved in a bunch of different criminal activities, banking fraud. They just come to healthcare because this agency is a massive target. We're, a big opportunity. If you can get beneficiary numbers or provider numbers from doctors, then you can start to build the agency, and it's hard for us to keep up. So we're actively involved in looking at ways of addressing this level of fraud. It's not just going to be piecemeal. We definitely have to put it on the radar screen for you in the media, but the American people as well. We estimate there could be up to $100 billion of this type of fraud, which we intend to claw back because these are vulnerable Americans who are losing access to care. When you populate hospice, there are 7 times more hospice in California than there was just a few years ago. You actually start to trick people to get into hospice to make money. We know of, I've heard testimonials from patients in California of loved ones who died because they were put on hospice, lost their Medicare, and then couldn't get back into the system. And so these are problems at many levels, moral, ethical, financial, and we're going to tackle them all.
Then the second question, probably either for Dan or you, Dr. Oz. I was wondering if you could talk a little bit about the income verification part of the new tools you're rolling out today. I spent a while last fall talking to states who were very frustrated that you had one dominant vendor, Equifax, really high prices, fast rising prices. Can you just talk a little bit about the income verification part of this and what's going to change, based on the work you guys have been doing?
Do you want to talk about Emmy first? Sure.
So as we started testing last summer, one of the things that we knew is we needed to provide alternative ways for income verification that are also easy for the applicant to use. And so that's where the Emmy product came in, our open source tool that's available for the states or their vendors if they choose to use it. But it also has a set of APIs that they can use. If they don't want to use our patient-facing tool, they can just use the APIs to get the data. Part of that is income verification. So an applicant can use that to log into their payroll provider, like their ADP or whatever payroll service that they use, and then that can automate their income verification and pass that through to the state so that they don't have to go through an onerous process and the states don't have to spend as much per query. And then I'll let Dan talk about other pieces of it.
And so Amy's also worked with a lot of the vendors we even are talking about. And our goal, as the statute also lays out, is to be data first, right? And so and what that means, the opposite of that is shuffling a lot of papers around as a beneficiary, trying to put that together. States already do grant, correct me, 50 to 60% of what's called ex parte, which is the automated process, right? To check information behind the scenes, say you're good to go. We don't have to include you in this process. Here are the exemptions. Here's the things that we already have, and checking their income. We're raising the bar on that and adding extra verification levels so that that's all data first, versus the opposite end of that is asking the beneficiary 100 different times to collect that information. So Amy, that's where she's tested all that data out. There's more testing to be done because there's a lot of exemptions as part of the process as well, so we can gather data around veteran disability status, where I come from in the Air Force, right? And so if we can make that a data-first approach, we don't have to ask the veteran to compile all their information together. So those are the types of things that all the vendors in the states are working on. Amy and the team has also piloted and continuing to pilot with states and new data sources as we get them.
Yeah, could you talk a little bit about the possible data sources? And I'm curious, kind of the system you mentioned where people kind of put in their payroll information. How successful do you expect people to be at that? You know, I know I have trouble remembering all the various platforms I need to log into, but tell me a little bit about how you're thinking about the Medicaid enrollees and like whether this is going to be an easy pathway for them.
So in our pilots, over 80% of people that have tried have been able to verify their information in less than 5 minutes. So we've seen really promising results there. And then, as Dan said, I think we're trying to find other sources like tapping into education, so that if they're in school, then we can automatically validate that for them and not even take them to the income process. Or if they are a disabled veteran, we can already find that out before they need to get to that place. So we just continue to add different data sources so that we can try to make it easier on the beneficiary.
Hi, Joyce Frieden from MedPage Today. Thanks for having this. First, I want to ask about the $600 million in savings. Is that entirely to the states, or is any of that to the federal government?
Great question. It's going to be to both based on our state-federal partnership. Now, we already invest, the federal government, anytime there is a technology product, we support the majority of those implementations with federal spend. The state has to bring money to the table as well. And so the good news is, in the end, states are going to get more money because of those grants, as an example, $2 to $20 million for all of those implementations. But it'll be savings for both the federal government and the state government as well. The states will actually prosper even better because there's money already in their hands with a grant. They don't even ask us specifically for a match for that, where we will pay the majority.
So can you divide that out, or do you just have to keep it general, like 300 to feds and 300?
It's a great question. Actually, we'll break that down for you because we can do it as we go through with the vendors and each state as they come through.
Great. And the second question, Amy touched on this a little bit in terms of, you mentioned kind of twinning the people who made the SNAP requirements, so therefore they're okay with Medicaid. Are there other examples? I'm just thinking about what happened in Arkansas, where people just couldn't check in, they didn't even have internet access, and the phone systems didn't work. Can you give some other examples of trying to make things easier for people who have to keep verifying that, yes, they're meeting the requirements?
Yeah, so I think the SNAP one is one of the biggest ones, actually, because of across the country, there is massive overlap between beneficiaries using both. Literally a majority using both of those benefits. So if you think about the pie of all the people that may be in this pocket that are eligible, we're going to basically take that off the table for those beneficiaries. If they're complying with work already in SNAP, then they won't even need to be part of that process. So when you bring up kind of the examples of no internet, that's going to happen all behind the scenes because the systems are now going to start talking to each other, which has never happened before. In the past, before this administration, everything was on the beneficiary. The systems did not talk to each other. Now we're making the systems talk to each other. We're making the vendors actually integrate with each other. Or if the vendor actually, one vendor has both of those together, they might work with both of those agencies. They're going to start bringing that together with us. That's the power of starting to bring federal government agencies together to work together. We're talking about student data. We're talking about IRS data. We're going big here, and this is because of Dr. Oz and thinking big about how do we make this easy for the beneficiary, because we've learned a lot, and Grant was in Georgia in the past. Technology, number one, has come a long way over the years. That's a big part of this. The things that you'll see in the vendors on these lists, this is all cloud-based. These are things where, when you're not on internet access, you can do things offline, and as soon as you get online, it submits for you, right? So these are differences between years ago than where we are today.
Yeah, go ahead.
I'll add one thing too, that with these tools that we're building, this is something that the beneficiary can do one time, and then we can continue to query. So if they continue to have the same job, or they continue to have a gig economy job like Uber, that's one of the big significant differences in some of these tools, is that it also includes gig economy workers, which prior solutions didn't have the ability to do. But this will allow it to continue to do. So as long as they have that same job or they're in the same school, we can continue to do that without them having to repeatedly do it over and over.
Yeah, I want to correct the thing I said earlier. You asked about the state savings. I think it was you earlier. This is really about the states. So the states save first. This is really where it's all about. They're the ones negotiating with their contracts with the vendors. That's where the money's all saved. Now, then they'll ask us, for participation on things that they may need on innovation. But really, the core of this is around the states. We're not, taking the money back. This is all about the states and their the prices and the lower costs that they're getting.
The EMI tool you keep mentioning, what is the specific benefit to states of using that? And do you know how many states are going to use it, and can you incentivize them to?
Yeah, so the IMI tool is an open source tool that's available for states that want to use it. We're working with several states and pilots right now, and there are many more that we've been talking to. So it's really up to the states whether they want to use it. We're just making sure they have that option for an easy to use open source tool. And then, as I said, also a big part of our offering is this free technical assistance to the states, where we have engineers and product people and designers and procurement experts that can also help them through this process with feet on the ground, helping them implement these solutions, whether it's our solution or some other solution.
Just to put some more texture, I was pestering Amy last year to do something so we'd actually learn what the challenges are that the vendors will be facing. And I think we learned a lot through Amy's hard work with her team. So we have an open source tool that many of the vendors could use as well, but they're going to build their versions of this. Ideally, we'll give states, like walking into a diner. They're going to be walking to an opportunity. They may not know all the foods that are sold there, but they want this package with this one. They want the scrambled eggs, don't want the waffles. And they'll be able to pick and choose accordingly. But the pricing has been pre-negotiated because we can do it for all 50 states. And by driving down those costs, and we were speaking earlier this year with Dan about this process, and Dan said, well, why not ask for it for free? Because free is a pretty good price. And it turns out for a lot of vendors, they do a lot of business in other areas. Just to be able to be in the game is worth it to them. And we looked at them in the eyes the way we did with pharmaceutical companies with MFN, and the way we spoke with the insurance companies about some of the challenges that we're facing with prior auth. And you say, you don't want to have a target on your back. People are critical of you for some of the business practices. They think you're upcharging, change orders, all the things that seem to generate tremendous amounts of expense. This program is to help our most vulnerable get off Medicaid into the workforce. If this costs a fortune and doesn't work, it's going to be a massive black eye. It has to be affordable, and it has to work. Amy's team helped drive some of the advances in getting your passport. I don't know how many of you have gotten the passport recently, but I remember going to the drugstore, take a picture, mail it in. You send your passport, it's gone for months. Now in 2 weeks or less, right? You can get send a digital photo in, which sort of makes sense. You get your passport made. Again, it's all done digitally anyway, and you get it in the mail. And so we want to show that we're capable, competent enough to deliver on the legal, the law that was crafted on July 4th, and we have a year and a half to do it, which is a bit of a race. So for all the states out there, most of you are well on your way. Thank you. We're working with you. There are a few states that have not been as aggressively pursuing this goal. This is vitally important to our nation. Please work with us. You've got pricing generated. You've got models crafted. You've got companies who have been willing to work with us to provide you the best service at the best price and in an expeditious fashion. Please take advantage of it. God bless you, Dan, and your team for pulling this together, and Amy for the leadership. Thank you.